Hello friends, I'm here again to discuss something more important today. I'm Dr. Pramoj Jindal, Senior Thoracic Surgeon in Sir Gangaram Hospital, New Delhi. So what are we going to discuss today? Today we are going to discuss hyperhidrosis, which is a very common problem. What is hyperhidrosis? In simple words, it is known as excessive sweating. It is excessive sweating during rest, which is unrelated to any need for heat loss during that period. It can affect one or more areas of the body. It can affect your palms, feet, armpits, face, everything. It can occur at many places. It can occur only at one place. Actually, today we will be discussing only increased sweating in our palms, which is known as Palmar Hyperhidrosis or excessive sweating of the palms. It is seen in around 1 to 3% of entire population. Occurs in all seasons, maybe in winters as well. It can occur at normal times, but it increases or might increase if a person is undergoing stress, anxiety, fear, nervousness, which can increase and worsen the symptoms. It is seen both equally in men and women. It usually occurs in childhood or early adolescence, and thereafter keeps on increasing day by day. It goes on to become maximum in 4th or 5th decade of life. Thereafter can decrease. It can occur in both the hands, more likely being similar, and most of the time there will be no associated problems along with this. If you see, palms are cold, they are wet, and few patients what we have seen are dripping wet. There is excessive sweating, and you can see droplets of water going down and down. So how do we diagnose? This diagnosis is done by only clinical examination and history taking. The patient will tell you since when it is started. Usually it is more than 6 months at least to diagnose it as Palmar hyperhidrosis. There are a few more or other conditions which can lead to increased sweating in the palms, and that is known as secondary hyperhidrosis, when there is some underlying disease which causes it. It can be any thyroid disorder, it can be pheochromocytoma, or any other malignancies or cancer in the body, and even infections, simple infections like tuberculosis can cause. There are few medicines which can also increase the excessive sweating. So why do we need treatment? We need treatment because it affects our daily lives, it affects our social life. And how come? People who are working, students, people who are working in electrical companies, or army personnel and few other professions, there will be very difficulty if they are sweating a lot. Clinical, do we need treatment? Yes, we need treatment. And what kind of treatment do we need? We can have treatment like topical, which is local, or systemic. Treatment can be temporary or permanent. Let's discuss with temporary treatment or topical treatment. The first and very commonly done is ionotophoresis, wherein there is passing of low voltage current through the affected areas, whether it is palms or soles. These are the two places which you can do. What happens is, because of the current, the sweat glands shuts down for some time. Initially it is to be done every 2 to 3 days, and once effect comes, one can go ahead with keeping at least once a week, and it has to be continued thereafter till when we have to have the effect. It is therefore very time consuming, though doesn't have very minimal side effects, but sometimes few cases of mild burns are also reported. The problem is that 25% of patients will not have any benefit at all by this, and around 50% will have minor improvement in symptoms. Around 50% will have only symptoms, a relief of symptoms, they won't be completely cured of. Next comes another local treatment, which is very, what I would say is very, very popular, and that is injections of Botox locally in palms. It has to be repeated every 3 to 6 months because Botox effect will last only 3 to 6 months. Multiple injections are instilled in palms, and multiple injections are given. It can be painful, and therefore it's a painful procedure to undergo many a times. Though there are no major side effects over here, but sometimes it is known that slight muscle weakness can be seen, particularly on the thumb area in some people. It will also not last long, and it will not affect give you relief in all the patients. Around 35 to 40% of cases you will not have major improvement in the condition. It's very well done for armpits, that is the axilla, not that effective in hands. Systemically we give few medicines, but the medicines have to be taken on and have got substantial side effects, so not a very good treatment as far as pulmonary hyperhidrosis is concerned. So do we have a permanent treatment? Do we have a treatment which can give you everlasting effect with least side effects? And the answer is yes, we have a very good effect, and that is known as thoracoscopic sympathectomy, or very commonly known as Watt's sympathectomy, wherein by small incisions we go into the thoracic cavity, into the lungs, near the lungs, and divide those nerves, which increases the sweating of the hands. And mind you, it's very reliable, simple. A day care procedure means you come in the morning and you can go in the evening. Both the sites can be done in the single setting, and the patient can be discharged on the very same day. The patients can resume his or her own activity most of the time on the very next day, and it's a one-time procedure, not very painful, and the best part is it is effective in almost all the people. It's a specialized procedure which has to be done by specially trained thoracic surgeons. The chances of side effects or complications are very minimal. The procedure is I would say not too long, and therefore it's a very effective and a nice permanent treatment which can be taken care in these sets of patients. Well, I like to say that any surgery in these sets of patients, pulmonary hyperhidrosis, is a life-modifying surgery which is simple, very effective, and compared to all types of treatment available, probably one of the best suited for young people. The patient along with the surgeons can discuss about the details of the surgery and treatment. I would say you should discuss it along with your surgeons to see for the treatment and take care of this problem, which can be very gratifying once treated. Thank you and all the best.